Hey class, it's Ashley Tharp, and I'm going to talk to you today about a patient that I saw this week that I found pretty fascinating. So this was a 33-year-old Caucasian female who worked in healthcare and had a past history of postpartum depression, of generalized anxiety disorder, of major depressive disorder, and PTSD. But what I found truly fascinating was, per the patient, she had no prior history of any type of mental health disorder until 2020. And it started after the birth of her second son. And so that was in early winter of 2020. And she reported the postpartum depression and the major depression started right after his birth. But she attributes a major uptick in her symptoms after she contracted COVID and ended up in the ICU in the spring of 2020. And she stated that she really struggled during that time because not only with the fear of the unknown in the middle of the pandemic, being told you had COVID, but she ended up with a saddle PE and an ICU stay. She was in the hospital for almost 15 days, where she was cut off from all of her support, from her family, from her friends, from her kids, and one of those being, relatively a newborn at that point. So she really struggled. She said that's where it really started to take hold on her, as far as her irrational fears and sort of this obsession that something bad was going to happen to her kids. Now, she was started on Zoloft after the postpartum depression was diagnosed, and she felt like it was working pretty well, and then all of a sudden it kind of just stopped. So then they started her on Abilify and Buspar, and the same thing kind of happened with both of those, honestly. She states that her symptoms at the time of admission were racing thoughts and difficulty concentrating, excessive worrying, irrational fears and phobias, and panic attacks. And her symptoms of her panic attacks are shortness of breath and tachycardia. She also reported that on a rating scale of 0 out of 10, she rated her depression as a 6 and said that it had really increased over the last few weeks as well, as had her panic attacks. She went from 1 to 2 a month to now she's having about 3 a week, and it's really impacting her work. So she ended up getting admitted because she started talking about having suicidal ideations. Now, when we were able to evaluate her, she was no longer feeling that way, and she contracted to safety, and you can read the full report in my paper if you're interested. But the other thing that I found really fascinating about her is when I was looking up some more education for this paper, and I was looking at depressive disorders, I started thinking about postpartum. And typically postpartum has a very shorter timeline than what, of course, this patient was exhibiting, since it's been 2 years since the birth of her child. But I found a study that said that approximately 5% of women will report persistently high levels of postpartum depressive symptoms for even up to 3 years after the birth of their child. So, and these depressive symptoms could be anxiety, the irrational fears, the sadness, the difficulty sleeping, exhaustion, and disturbing thoughts, which our patient had all of those. So it really made me start to think, could this be a delay or an extended postpartum depression? The good thing is it's managed kind of the same way. And so they started her on risperidol and 5 milligrams twice a day. And that was for the PTSD and her obsessive thoughts and behaviors, which you can read more about that in the paper. The good thing about the risperidol is there is an LAI formation for that. So if she tolerates it well, she could potentially be getting a shot once a month. And they increased her Zoloft from 100 milligrams to 150. If you have any questions, please feel free to reach out to me. Thanks. Have a great day.